Welcome everybody to this week's video where Becca McDonald is going to talk about her role as a physical health nurse in the prison service. This is Becca's first post as a newly registered nurse and she's 6 months post-registration, and lots of viewers have asked for something on prison nursing and careers, and Becca has kindly offered to tell us about what she does, the team she works with and different career pathways available in the prison service. So welcome, Becca.
Hi, you okay?
So I thought we'd start with what made you go into the prison service, Becca, as your first post on registering as a nurse.
So I've always known from starting my nurse training that hospitals weren't my area. I don't know what it is, but just for me, I much preferred the out of hospital placements that I did. I was lucky enough to get a placement in a prison as a student. I asked the university if this was possible, and they said they do offer them. So I was able to actually have that placement. And as soon as I went in and I got to work with some of the people who might not necessarily have accessed healthcare as much as other people I'd come across, and just being able to make a difference and have that impact on them, I knew that that was where I wanted to be with my nursing career.
It's amazing to get that feeling, because it took me years to get that feeling of what job I actually wanted to do. So it's fantastic that it was that exposure during that placement that fired up that passion. So have you got any tips, Becca, for people securing placements? Did your university have that down as a regular placement, or did you sort of have to proactively try and secure that prison placement? Do you want to talk a bit about just securing the placement?
So I had to be quite proactive about it. It wasn't something that was regularly offered at my university, especially not for the adult nurses. If there was the placements, it tended to be more for the mental health nurses. But I was proactive about it. I said to my university, I'm really interested in looking at going into prison nursing. I'd like to get an insight into it. Do you offer this? And they were able to sort it out. And from then on, I have noticed more students going out there on placement. So I think it's something that people have wanted to do, but were too scared to maybe ask if they can go on placement there.
Yeah. And have you got any tips for securing the placement? Like, have you got any tips for anybody out there that they've never done it at their university before, for example?
Get in there quite early and just email whoever sort of sorts out the university placements, whether that is your sort of like the careers team, the placement team, personal tutors, staff that you know maybe have connections, and just say, I'm really interested in doing this. What is the next step? How do I go about it? Is it something that's offered? And just kind of get in there quite early and start that contact with people to see if it is a possibility, and then look at sort of how and when you could go about doing that.
There's some really good advice there, Becca. Thank you. So I know that you're an adult nurse, and we talked through the 3 areas and the teams for nursing in your prison service when we met previously, which are adult physical health, mental health, and substance misuse. And so do you want to tell us a little bit about those teams and how you sit as an adult nurse, which is a bit more unusual? I mean, should really get some mental health nurses on actually as well to talk about it. But how, obviously, you're working within those teams. So how does your role sit, and a bit about those 3 areas?
Yeah, so I sit within the physical health area of the prison nursing team. So I am looking at more of those triage of patients coming in with your physical health ailments, so wound care and all those lovely things. But we also have mental health nurses, substance misuse team. So you've got your mental health nurses that will be doing mental health assessments and capacity assessments, things like that. Your substance misuse team are looking at people that are coming in with drug use, alcohol use, that might need a bit of support and guidance with that. But also, we end up picking up bits of all 3 of these areas. For example, one of my roles is seeing all the patients that come in and out of the prison. And if they come in with substance issues, I'm having to do their withdrawal assessments and their clinical assessments to look at what help they could be needed, and then signposting them to those areas. So we do end up picking up bits from all over, really. Even though I sit within physical health, I've definitely learned a lot of skills in regards to mental health and substance misuse as well.
So you've sort of started to talk a bit about your typical day, and what your key responsibilities is. Is there anything else additionally? So clerking people in and out, but anything else you want to sort of talk about with your responsibilities? Because you're newly registered as well, aren't you? So
so no day's the same really for me. We have 3 different main roles at my prison, but I do know that other prisons may vary in how many roles they have because of staffing and things. But our 3 main roles are, like I said, one of them is being in the reception area. So any patient that's going to court, coming in from court, transferring to another prison, coming into our prison, being released, or brand new from a police station or the courts coming into the prison. We have to see them all. We have to do a little health screening for both physical health, mental health, as I said, substance misuse as well. So we can signpost them and get them some help with maybe like a detox, or just any support networks there are out there for them. Also, one of my days can be spent doing quite a lot of medication rounds. So we have somebody that's their role for the day is to do the morning and tea time medications, which last about an hour and a half to 2 hours each. And then in between that, they're doing what we call our second healthcare screenings, where you're going getting a little bit more of an in-depth knowledge about family health history and vaccinations and things, to see if there's anything that we can assist them with whilst they're here in the establishment. And then the other role you have is our Hotel 1, as we call it. So that's because that's what the radio you're carrying, and that's your triage list. So as I said previously, you're doing wound care. You're going seeing people who might have said they're feeling generally unwell, or anything that you might see physical wise in the community. We go and see them and give them some, help, guidance, wound dressings. But also you're on the emergency call outs as well. So if you've got any emergencies that day within the prison, we are grabbing our kit, we're going to them, and we're seeing what's happening, and we're the first on scene normally to all of them. So it's a bit different every day depending on what role you're doing.
I mean, it sounds, even though you're doing lots of the physical health, it's holistic approach, isn't it, that you're talking to about the mental health, physical, psychological, social. And I'm just going to ask you about shifts as well, and just a little bit more on this question. So what's your typical week like? So is the shift like what you'd work on a ward? Because I know people have been wanting to think about this.
Yeah.
Is the shift still like what you would have on the ward? Would you have to do like long days or short shifts and weekends and stuff? Do you want to just sort of, and how many do you get off and stuff like that? Because people will be interested, because community is probably less weekends. So what's your typical shifts like?
So it does vary again from prison to prison. I know nurses that work in other prisons, but for my prison, it's 24/7 care. So there is a nurse there overnight, there's a team during the day, bank holidays, weekends, we are there. So it is like the wards. I work 13-hour shifts. So I do 7:30 a.m. till 8:30 p.m. But then I have an hour for lunch and then a half-hour tea break in there. So I get an hour and a half breaks throughout the day. You can also do the slightly shorter shifts, which we call the full days, which is a 7:30 a.m. start, but a 6 p.m. finish. So you get an extra couple of hours back at home there. There are on occasion sort of your early shifts that finish at 3:30, like used to be when I've been on placements, and those are the early shifts. But and then your night shifts as well, they're the same way. You're there from sort of 8 p.m. until 7:30 a.m. in the morning. So it's a very, very similar shift pattern to what I've experienced in the hospitals. But again, with different prisons, I do know that some prisons don't have night cover, so they might not be the nights, and just prisons work slightly differently, but there is a nice range of shift patterns. And for anyone interested, especially with placements and stuff, it's a great question to ask your placement, sort of say, what are the shifts like?
And you talked about the tick, because I naively, everyone's used to seeing prisons on TV, and you don't see a lot of nurses, do you? See the medical room, they have to go to a medical room. In my naivety, I didn't realise that you've got big teams. So because I think that might put off newly registered nurses, might think, oh, I don't think I've got the skills, you know, I'm newly registered. But just talk through, you've got quite large teams, haven't you, in relation to you've got those 3 different types of teams with physical health and the substance abuse, etc. But you've got a structure there, haven't you, sort of similar to what, do you want to just talk that through a little bit?
Yeah, of course. So we have quite a large team. My prison is only quite a small prison as well, so in terms of the team we've got, it's a really strong amount. We have our baseline is that you have 3 physical health nurses a day, and then there's probably normally 2 to 3 healthcare support workers, physical health as well. Mental health have normally got about 3 or 4 nurses. They have a couple of band 4s as well that assist them. We've then got the substance misuse team, the support workers. They've normally got a team of sort of 5 or 6 in the office. We've got a pharmacy team that's normally about 3 or 4 a day. And then from your Monday to Friday, you've also got your GP that is on site, not always, you know, every day, but and then you've got an ACP as well, so your advanced clinical practitioner. So we do have a very strong team across.
Yeah. I mean, that's fascinating to me, because this is what a lot of, you know, there's lots of misconceptions, isn't there, and there's different perceptions about prison nursing. And what you were talking about is that amazing, you got a lot of support, you know, when you started. So if we go on to the next question, actually, because it links to this, again, something that puts, I think, newly registered nurses off going straight into prison nursing is they think they've got to have this, you know, experience already, and you know, you're proving that you don't, and you did get really good preceptorship. And so talk through the training, the courses you've had, you know, to help you, and you had some supernumerary time and preceptorship. So talk through your training and courses.
Yeah, so obviously, as you said, I went straight in as a newly qualified nurse. I also used to believe that you had to have experience elsewhere prior to going into the nursing field in the prison. But my supernumerary period and my preceptorship have both been absolutely incredible. Obviously, I know it varies trust to trust, area to area, but I think I was set about 4 weeks supernumerary. So when you're working an average of 3 to 4 shifts a week, it's a good length of time to be able to pick up what you're doing. But then also, even though I started to go out doing areas on my own, I wasn't actually in the numbers for sort of another week or so, because it gave me that bit of a stepping stone into that autonomous working without actually being in those numbers. So I could always call somebody and they'd, you know, be round the corner, they could come straight in. But that is also something I found anyway, is that even when I am autonomous working, yeah, I might be in a room on my own, but I've got a radio, all I have to do is ask somebody and they'll come straight round. So I love that. And with the preceptorship as well, it's really good. We get protected time for me and my preceptor to sit down to create plans of what I'm happy that I've achieved, what I'm looking to achieve over the next sort of few months. And we do that every 2 months. So it keeps that really good regular basis of being able to sort of just engage with her and make sure that she's happy with what I'm doing, I'm happy with what I'm doing. And then also things like the team that I'm with at the moment, the training opportunities are really good in terms of getting some minor illness and minor ailment training and wound care training, triage training, all the different things that you're coming across. They offer so many amazing training programs to be able to sort of build your skills up on things like that. So
that's
even
amazing.
if you've got prior experience, it's definitely something that they push and strive for their staff to get in there.
I mean, it's really structured, isn't it, as well, and having so much supernumerary time, but you obviously need it as well for that. And you talked about having the walkie-talkie, not walkie-talkie, what do you call it?
The radio.
The radio. Because I suppose one worry or concern would be that your safety as well. So we just talk a little bit about that. Do you feel safe that you're not left on your own necessarily if somebody's at risk of, you know, and putting yourself at risk as well, or they might be at risk of harming themselves, for example, that you sound like you've always got someone to go to. You've got are you left alone sometimes when you're doing your admissions, or do you always have somebody with you? So talk through the safety elements.
Yeah.
Yeah.
So in terms of actually coming into contact with the patients that we see, obviously there is that patient confidentiality is still there. So there are occasions where it might just be you and the patient having this consultation, this discussion, or doing those dressings or administering those medications, things like that. But in terms of safety, there's so many things in place that I do always feel safe in my role. And I think it's one of those things that I thought before I started, and a lot of people think when I speak to them of, oh, that must be so scary. Like, do you feel safe? That's the one question I always get asked. And I can always confidently say yes, because as we said with the radio, every member of staff that is on the shop floor, as we'll call it, out seeing people, has a radio. So all the officers, all of healthcare, we have a radio. So, and we can hear everything that's going on, any movement. So you get into any bother, or you feel a little bit uncomfortable, or like a situation could evolve, you can press for it, you can tell them where you are, and people will come to you. There's a little panic button on the radio as well that you press that, and instantly people will come and run to you, check you're okay. Even so much so, we've had it where people have accidentally leant on their radio button and accidentally transmitted, but it's not been heard by other people because it was an accident. And then our comms unit will then come through the radio and just say, are you okay? Because I heard you were transmitting, but I couldn't understand. And they'll check in on you through there. So it feels very, very safe and supported wherever you are. So even when you're physically on your own, you don't feel like you're on your own.
Yeah. So are there any specific skills that you think you need to work in the prison service, Becca?
One of the massive ones that I think a great skill to have is your communication. And I know that's the same wherever you work. I think as a nurse, you do need communication, but especially in a prison environment, you're working with people that, as I've said previously, they're not always people who have accessed healthcare to the best of the abilities, and sometimes they don't necessarily understand why they might need this healthcare or the risks of not having certain things. So it's being able to have that communication to be able to talk through things with people, let them know everything. Again, it goes back to that informed consent, which we're doing everywhere, but just being able to really have that conversation with people, and also through your communication, de-escalation as well, because people that were coming across can be quite sort of volatile at times. So being able to diffuse situations before they escalate and things like that is one of the skills that I've definitely found quite beneficial going into the prison, is that I like to talk to people. I can communicate with people, and it's definitely been a massive help.
Yeah. And I suppose being non-judgmental and holistic, person-centered, you come across really lovely and open and warm, and I think and with excellent communication skills. Would you say sort of being non-judgmental and holistic, person-centered care as well, seeing the person there, not the illness or what? Yeah,
definitely. Again, you could go on to all the skills that you use across nursing, because they are those skills that you do use when you're in healthcare. But that is one, obviously being in the prison service, it is that being completely non-judgmental, treating a patient as a patient, not for what they've done or what they may have done, or what you've potentially read about them in the news or seen about them. Being able to just offer that completely non-judgmental care that you would offer for every single person that you came across, whether it was in a hospital, whether it was in the community, in a GP practice, and offering everybody the exact same level and the best of the care that you can offer, of providing that to them. Definitely.
Yeah. And I ask this question to everybody, Becca, because all roles have got challenges. They're not perfect. What would you say are the main challenges in your role, and how would you overcome those sort of challenges?
So one of the big challenges that I think everywhere has is staffing. As I said, we do have a very, very strong staffing team, but as I mentioned, with those three core nursing roles that we have a day. If you have somebody that's off sick and you can't get cover for it, you notice that you've got that nurse not in your numbers. So having to be able to shuffle things around and potentially extend shifts. Like I extended a shift last week because we were a nurse short. So instead of finishing at 6 o'clock, I finished at 8:30 because I knew that those last couple of hours just helped the other nurse out with making sure there was somebody there. So staffing's always going to be one of those issues. And also in terms of when I said about getting patients to understand that the care that they need, a thing that I've come across quite a bit, especially recently, is patients in the prison not wanting to go out to hospital, not wanting to seek that treatment, or not wanting to attend appointments because they've been in their cell and now this is their time to come out for exercise or to come out for association, but they've got a doctor's appointment. They don't want to go and sit in a doctor's appointment when they could be outside in the fresh air, you know, playing you know, football sort of outside. They'd much rather go and do that than go and see the doctor. So that can be quite a challenge, because it can be quite frustrating as a healthcare professional knowing how difficult it is to get these doctor's appointments, and then knowing that they're not turning up for them because they'd rather be elsewhere. So again, it goes back to that communication of being able to discuss with the prison officers as well, and explaining the importance of going to an appointment to the prison officers, so that when they are taking the prisoners outside for exercise, they can say, oh, but you've got a doctor's appointment. Do you know that it's really important that you go and get that seen to? And just sort of liaising with them and informing them of the importance of these, so that we can pass that down to the patient and make sure that they get the care that they need, really.
Yeah. And you mentioned about escorting and transferring patients as well. That can be quite challenging. When we met before, you were sort of talking about that.
Yeah, so that can link back as well to staffing. So not only can healthcare have issues with staffing, but the actual prison can have issues with staffing as well. So every time a prisoner has to leave the establishment, it takes a minimum of 2 officers to go with them for security. If they go in one of the cars that the prison use, it's a third person because somebody has to drive. So that again, it links down to staffing, that we can have times where appointments can be sort of questioned if they can be reshuffled because the prison haven't necessarily got the staff to be able to facilitate it through no fault of their own. It's, you know, it's staffing, it's what happens. Having to sort of try and liaise with them and say, right, okay, it's really important that this person has their appointment, that this person that was supposed to go out this afternoon, we can make that a telephone appointment. And being able to sort of come up with contingency plans for when there's situations like that, and working with the prison to be able to do that, really.
It's fascinating, isn't it, how staffing is across every aspect of nursing, isn't it? So final question, really. What are your career aspirations, and is there career pathways in the prison service that you can sort of aspire to and move on to? But yeah, just a bit about career pathways and where you see yourself. And
so obviously at the moment I'm getting my experience, only 6 months in. I'm like, I'm looking at getting all those skills and things, but I know that in the future I'd quite like to go down the clinical, like the advanced clinical practitioner route. As I mentioned earlier, we've got an amazing ACP in our prison and her skills are phenomenal. So I quite like to do my non-medical prescribing and my ACP and go through there, which is something that is offered quite often through the prison services, both NHS and private, because healthcare is run by either NHS or private within the prison service. But I have seen that the big companies and the NHS trusts that run the prisons, they do offer these progression pathways for advanced clinical practice if people want to go back to uni and do that. So that's definitely something I'll be looking at in the future, because I love my clinical aspect. And I'd love to be able to sort of run those clinics like I see the ACP doing, and using some of those like diagnostic tools and those prescribing tools to be able to really have that best impact. So that's my plan for the next few years.
Oh, good luck. Wishing you well with that. I mean, it's fascinating because I honestly, and I, live and breathe careers and interviews, etc. I didn't realise that there was ACPs in the prison service, and you've changed my perception. So you'll be changing, students and people's perceptions out there, that there is those career pathways, and they sound like really supportive of, of you with the modules, etc. So I wish you well with your career pathways. So have you got anything else you want to add at the end or anything, or?
Not particularly, just that I know
No.
one of the things that I sort of came across when I said to people about going into the prison service was people turning around and saying, oh no, you can't go into the prison service straight away as a nurse, as a newly qualified, you'll lose your skills. And I now can say 6 months in that I've not lost any skills that I've needed in this role. I've built up the skills for this role, the same as if I was to move into a completely different area, like, cardiac nursing. I'd have to learn a lot of skills about the cardiac aspect, and I'd lose potentially those skills that I've got in the prison with that communicating about substance misuse and things like that. So just that for people that want to go into it, to just do it. You can do it as a newly qualified nurse. Go and get those skills, and that's definitely definitely something.
I mean, you're just amazing to listen to because you're so passionate about it, and you seem to really enjoy it. It's like you found your area, your career area. So thank you so much, and for changing perception. You've changed mine, and I'm sure you'll change a lot of people's perceptions out there, of prison nursing as a career option. So it's fantastic. Thank you so much for giving your time, Becca, today. Really appreciate it.
Thank you for having me.